And Doctors McCullers and Murray, if you see over on the right-hand side, if you click participants at the bottom, you'll get a window on the right, and there's panelists and then attendees. And so you can see the attendees on the right-hand side of your screen if you open that up and can scroll through them.
So I see we have a number of people coming to our webinar now, gentlemen, and we'll give them a few more minutes to finish coming in. We had a total of about 215 people that registered for this, so we have a nice audience. And to the audience, and we'll say this again, to the audience, when we get to the question and answer portion of our webinar here, you should notice a question and answer button down at the bottom of your screen. And we just ask that you use that, and then we can direct your question to the appropriate person. So we'll give it another minute or so here and let people finish filing in. And then I'll hand it over to Dr. Bird, and he can take it from there.
Good, good.
Okay, I've got 10 o'clock, so, and we have a number of attendees that are here now. And we have our first question, and the question was, can you describe how to access the attendee list? And attendees cannot access the attendee list, only the hosts can. And so moving forward, the only way to interact with our webinar will be to list your question in the Q&A box, and we will try to answer your question. That being said, I would like to turn it over to Dr. Herb Bird, the Vice President at the Institute for Public Service. And Herb?
All right. Good morning, everyone. We appreciate your being able to join us this morning for this webinar, where we expect that you'll get some information pertinent to Tennessee and what's going on with the coronavirus in our state. There's been a lot of information out there that has been general or generic to the country, and so we have two experts today that can talk specifically about Tennessee, and so we wanted to give you this opportunity to hear firsthand some of the things and projections that we have for Tennessee and see some of the issues going on directly in our state. And so this morning we're glad to be able to spend a little bit of time and appreciate our presenters coming on. One more time for those that have joined, Scott mentioned this earlier, but you can ask a question at any time by clicking on the Q&A at the bottom of your screen and typing in your question there. And those questions we'll try to get to them either as being recorded, and so we'll have it linked where we can get back to it at a later time. So if you have a question, remember the only way you can ask that question is through the Q&A dialogue, where you type your question in the box and submit that, and we'll try to get to as many of those as we can. First up today, we have joining us Dr. Jon McCullers. He's an infectious disease expert, a professor and chair in the Department of Pediatrics in the College of Medicine at the UT Health Science Center. and he is also pediatrician-in-chief of Bonheur Children's Hospital. And so, Dr. McCullers, we welcome you here this morning. We appreciate you taking some time to share with us some of the state of the coronavirus in Tennessee and kind of where we are today and where it looks like things are headed.
All right, well, thank you very much, Dr. Bird. I'm very happy to be here today. I'll talk a little bit, maybe 15, 20 minutes about the virus and what we've been seeing in Tennessee, some of our responses to it, and really what we're going to need to do to try to get through this and try to get on with our lives. A little more of my background. I am a virologist and spent a good deal of my career at St. Jude Children's Research Hospital studying pandemic influenza viruses. So I've just jumped over a little bit into coronaviruses recently and have been helping lead our response here at UTHSC on the west side of the state in Memphis, Tennessee. So, I think the first thing I would start with saying is that it's not a surprise that we're seeing this virus right now and that we're seeing a pandemic from this virus right now. We do know that these coronaviruses, which are mainly animal coronaviruses, can cross over into humans. We have 4 different coronaviruses that have crossed over from either rodent or bat reservoirs in the last century or so, have established themselves in humans, are now part of the common cold complex. And so just cause common colds along with a lot of other viruses that do the same thing. About 18 years ago in 2002, 2003, we had what we call a severe acute respiratory syndrome coronavirus, or SARS coronavirus, cause an outbreak across a lot of the world for about a year. This had about a 10% mortality associated with it, had 700 or 800 cases across the world. Not much here in the United States, but it was a significant warning that these viruses were able to do this. We had a second one of these, the Middle Eastern Respiratory Syndrome virus, or MERS, that crossed over out of the bat reservoir through camels about 7 or 8 years ago. Again, had a very high mortality rate, about 30% mortality rate, and infected 700 or 800 people across the world before it went away. The most recent one now, this SARS-2 coronavirus, or the novel coronavirus as we've been calling it, came out of bats, again, like these other ones, and appears to be a little bit different in that it's more respiratory in nature and it's able to transmit very easily from person to person. The other SARS coronaviruses and MERS did not transmit quite as easily, and so didn't get as much of a foothold and didn't spread around the world as easily as this one has. This virus is now spread across the entire world, as you know, is in virtually every country, and is going to be with us for some time. We do not expect this virus to go away like SARS did or MERS did. It's just too widespread for that. So it's going to stay with us for a while. It'll continue to circulate, and hopefully we'll be able to get it under control at some point. So, why does this virus transmit so easily? Well, there's some technical answers to that, but the real issue is that it's able to spread through respiratory spread, whereas the SARS coronavirus mainly spread through GI spread, through fecal oral transmission. This virus will spread through the air. You can get the virus if someone is coughing around you and you happen to inhale the virus that way. You can also get it if they contaminate a surface. So if they are coughing and get it on a surface or a doorknob or something like that, and in some hours later you touch that and touch it up to your mouth or your nose, that's how you would get the virus. Those two ways really: have somebody coughing around you and get it directly, or get it indirectly through a contaminated surface. It's very infectious, so it's able to do that very easily in the environment. So here in Tennessee, as you know, this has come worldwide and got into the United States a couple of months ago. We've been seeing cases in Tennessee for about a month now, starting in the Nashville area, but then really spreading all the way across every part of the state. As of yesterday afternoon, we had 4,246 cases in Tennessee, up to 83 deaths in Tennessee. And so that's a little over a 2% mortality rate. So very significant mortality rate. One of the things we have to understand with that mortality rate and with the number of cases we're seeing is that we continue to significantly under-test for this virus. We're not prepared as a country or as a state to be able to test very easily for this virus up until recently. And so there's a lot of cases out there. We know there's a lot of cases out there that are just completely undiagnosed because we've only tested a small fraction of those who are ill. We understand with this virus that something like 20% or maybe 25% of persons who have it are completely asymptomatic, so they don't even know they have the virus. They are able to pass the virus on and transmit it, probably not as efficiently as somebody who's sick. The sicker you are, the more virus you're going to be putting out, so the more infectious you're going to be. But even if you're completely asymptomatic with it, you can transmit the virus. About 60% of people who have it will have some mild symptoms, typically a little bit of fever, some cough. This virus, unlike many others, doesn't cause much upper respiratory symptoms. So if you have runny nose and congestion and those things that are typical of the common cold or of allergies, it probably isn't this particular virus, and it's probably not COVID-19, which is the disease the virus causes. This virus, when it has moderate to severe symptoms, has that fever and cough and kind of a general feeling of malaise. You just feel bad, you're fatigued, and then you start to get problems with your breathing. So lower respiratory symptoms, difficulty breathing, chest pain are really the signs that you're developing this particular disease and getting in kind of that moderate to severe category. Some people, well, typically when we see this, you'll start to have your first symptoms 5 or 6 days after you've been exposed to it. This can be up to 14 days after you've been exposed to it. The first symptoms are usually this, feeling bad, this kind of overall fatigue and malaise. Fever and cough are usually the second symptoms within a day or so of the first symptoms you have. And the lower respiratory issues start 5 or 6 days into the disease. So there's kind of quite a long period that it develops where 5 or 6 days before you start to see symptoms, another 5 or 6 days before you start to get severe enough where you might come to significant medical attention, like being hospitalized. For many people, they get better at that point, a couple of days after starting to have the lower respiratory symptoms, but some don't get better and end up in the hospital. This ends up being something like 20% of people will have moderate to severe symptoms. About 6, 7, 8% of those will have to be hospitalized. About half of those who are hospitalized are sick enough to need intensive care. About half of those need to be on a ventilator, and about half of those actually die from this. So there's a pretty significant number of those we identify who end up in the hospital or who end up with mortality. Most of the mortality across the country has been concentrated in those who are 60 or older, and typically the older you get, the higher your risk of mortality, and particularly when you have some comorbidities like heart disease, lung disease, diabetes, hypertension. Those things tend to be risk factors for worse disease and for death. Here in Tennessee, amongst those who are dying, it's a similar pattern to some extent in that many of the deaths are in those over 60. We are seeing deaths in younger populations in Tennessee, often associated with obesity. So that's one of the risk factors that we know is a big problem in Tennessee across the board. Something like 1/3 of adults are either overweight or obese. And so we are seeing many young people who are either critically ill, who are dying from this, who have obesity, diabetes, hypertension, comorbidities like that. In many parts of the state, particularly the urban parts of the state, we're really seeing a concentration of this virus in African American populations. This has been a story in several other cities around the country where we're seeing a significantly higher proportion of African Americans with severe disease and deaths than others. We think at this time that's because of the issues linked to poverty and lack of health care in Tennessee, and having more of these comorbidities like obesity and diabetes and hypertension and lung disease and so on. But that's something that's under active investigation right now. So the response to the virus so far in Tennessee, again, we had our first cases a little over a month ago, and as cases came first into the Nashville region, and then about a week or so later into Memphis and to some of the other metropolitan areas, and then a week or two after that out into other more rural counties, we began to see this series of executive orders starting again in Nashville, then in Memphis, and then going statewide a couple of weeks ago to do things that we think are going to mitigate the severity of the virus. So these are things like this social distancing, trying to stay 6 feet away from people, trying to cover your cough. Wearing a mask in public is one that's been talked about a lot recently, again, to protect you a little bit, but also if you happen to be sick or even asymptomatic and transmitting the virus, to keep from passing that on. It's hopeful that these sort of measures of just staying away from other people and not gathering in large crowds and practicing good hygiene will help sort of slow the spread of the virus and allow us to deal with it a little bit better. We've had these executive orders that are called safer at home or shelter in place. Those are the same sort of thing. It's trying to really reduce social contact, keep the virus from spreading, knock down transmission of the virus. And these have become a little bit more thorough and severe as the weeks have gone on and as the epidemic has spread further and further. There's two things that we kind of hope to get out of these, and we're not really sure which one we're going to get right now. One is what you've heard a lot in the media, which is called flattening the curve. The idea here is that a certain number of people are going to be infected. If they all get infected at once, that's going to overwhelm the capacity of our healthcare system to deal with it. So if we can slow the spread it out a little bit, maybe the same number of people will get infected, but maybe it'll be spread out over a longer period of time, and we won't overwhelm the health system. So that's one of the big things that we're trying to do. With the more, I'd say severe restrictions on movement, things like shelter in place and the urge, just to shut down as many businesses as we can and prevent as much social contact as we can, we may actually see something a little bit differently, which I call truncating the curve. And that may be that we stop transmission or slow transmission to a point where we actually see an earlier peak and we see it cut off a little bit earlier instead of that long spread out peak that we've been talking about with flattening the curve. We're not really sure which of these we're going to see. Some of the Asian countries such as Singapore and South Korea and Taiwan, as well as Iceland and a couple of other places, really saw a much shorter truncated curve when they took these measures as opposed to that longer flattened out curve that we've been talking about a lot in the media. So we've been doing those mitigation measures for 2 or 3 weeks now across most of the state. We're now moving into a phase of what we call preparation for the surge, and that we are seeing a significant number of cases, particularly in metropolitan areas that are severe, that are in hospitals and intensive cares. Here in Memphis, we have something like 80 people who are positive for COVID and are in intensive cares here within the metropolitan region, another 80 to 100 who are suspected of being COVID, but the tests aren't back yet. So that's a pretty significant number already, and we're seeing that increase day by day. And so the hospitals are all preparing for what we think is going to happen, which is what happened in New York City and Seattle and New Orleans, which is really a surge of critically ill patients that, hopefully will not overwhelm the health system, but we're trying to prepare for that as well as possible. Governor Lee has designated in all the metropolitan areas of the state to start to set up some field hospitals to deal with the surge. So if we run out of capacity within the hospitals, we'd have the ability to move patients out into these field hospitals that are between 200 and 1,000 beds. You've seen this done in New York City. We're preparing for this now in Memphis and Nashville and Knoxville and Chattanooga to be able to do that if it becomes necessary. We are talking a little bit about what are some other things we can do. What can you do about treatment for this? How do you take care of patients? Most of it at this point is just purely supportive care. It's providing oxygen, it's providing IV fluids, it's providing mechanical ventilation on a ventilator if you need that. We do have some experimental therapeutics that are coming into clinical trials now. We're testing some of those here in Memphis under clinical trials or under compassionate use. I don't think we're going to have any significant treatments for this during the first wave of disease, so the next couple of months, but the hope is that we'll have some sort of answer before the second wave, or at least for subsequent waves over the next couple of years. The one modality of treatment that we do think is going to be helpful is using convalescent plasma. And so this is the idea that if you've been infected and you've recovered, you now have blood that's rich in antibodies against the virus. And if you're able to donate blood a few weeks after you've gotten over the virus, we can separate out those antibodies and infuse them into other people who are critically ill and hopefully help control the virus. So a number of places around the country, including us here in Memphis, and I know in Nashville, are now setting up systems in order to be able to identify people who've had the virus, collect plasma, and be able to infuse it into critically ill patients. But I think that's probably the only significant treatment modality we're going to have for this particular first wave of the virus. So when I talk about first wave and subsequent waves, what we have to understand is that this virus is not going away. So some countries like China and Singapore, South Korea may have been able to control it temporarily, but they're still seeing cases. And we do expect that if we open our businesses back up, we open travel back up, that we're just going to see a repeat of this first wave. We'll see a second wave very similar to the first ones. So there's a lot that we need to do starting now, but then particularly in the period after the first wave is over, to prepare for a second wave and to prevent it from being so bad. And hopefully, if we have good enough preparation, we won't have to do measures like safer at home and shutting down the businesses and so on. So if you think about, what are the different possibilities? I think about 4 different things, and 2 of them are fairly extreme, right? We're expecting to see a vaccine maybe in 18 months, but probably something around 2 years from now. With the manufacturing time and the distribution time, I'd expect that even if we do get a good vaccine in the next 18 to 24 months, it's going to take 2 to 3 years to be able to get it out to people. So one, end of the spectrum would be, we could just say we're going to shut down the economy, do safer at home for the next 2 years until we have a vaccine. Obviously, that's going to destroy our economy as we know it. It's not going to be tenable as a way of life, but that would literally save the most lives. That's one extreme. The other extreme is we say, okay, we're not going to shut down anything. We're just going to let the virus burn its way through the population. We're going to establish herd immunity because a significant number of people are going to be infected with that wave. And that's going to get us back on our feet the quickest. It's going to have the least impact on the economy, at least short term, but it is going to cause the most deaths. Most people have said that's unacceptable. We're not going to have that number of deaths and have our health system overwhelmed. And the longer term implications for the economy are significant doing it that way. So we've been looking at a couple of middle paths to this. And the one we appear to be on right now, if we don't do anything further, is kind of cycling in between. Everything's shut down like right now. Hopefully we open it back up in a couple of months as the virus gets under control. But a second wave comes back, we shut everything down again, open up, and you kind of go back and forth with this, being open and closed until we either have a vaccine or we have enough herd immunity. That's going to cause, of course, tremendous economic damage not quite as bad as shutting everything down for 2 years, but it's going to cause a very similar thing, and it's going to lead to sort of an intermediate number of deaths. So we think really the fourth possibility, and the one that we're working towards in a lot of parts of the country right now, is the best one, and that's to really have a massive public health response after the first wave is gone to get ready for the second wave. And so what does that entail? Well, it's 3 different things. One, and the most important one, is we have to be able to have absolutely massive scale ability to test. We have to be able to test everybody who's symptomatic. We have to be able to test all of our healthcare workers and first-line responders, and we have to know that in near real time. So we need to get rapid tests that we can do within a day or so, and we need to be able to test everyone we can possibly find who's sick and identify those people very quickly as we move into a second wave. The second thing we have to be able to do is we have to have a massive public health response. So typical public health measures are what allowed South Korea and Singapore and Iceland and other places to control this first wave very rapidly. You identify patients who are sick. You identify all of their contacts through contact tracing. You quarantine those who are infected. You isolate everybody who's a contact for 14 days. And you just do this on a massive scale for every single person who has come into contact with the virus who's been infected. And that will effectively shut it off and keep it from breaking out into these bigger waves that we're seeing. So South Korea continues to see about 100 cases a day in a population of about 50 million within that country. but it's absolutely under control. They've never had to shut down all their businesses. They've been able to go about their life as usual. They are practicing social distancing, and they're working from home as they need to, but schools are open, businesses are open, and they're just kind of tracking these 100 new cases a day through a massive public health response. And that's what we need to be able to get to as a state. We need to have an apparatus in place that allows us to test, allows us to do the public health contact tracing and isolation, and that'll keep the cases low enough that we won't see this widespread that requires us to shut down our economy. The third piece of it is we have to be able to test for immunity. So we're developing tests now. Some are coming commercially available, and then we're developing here at UT to be able to see if you have antibodies. So if you've been infected with the virus, whether you knew it or not, you will likely have antibodies that will protect you against subsequent waves of the infection. And we need to be able to identify you and certify that you have antibodies and that you're presumably immune to this virus. If you are, then you're able to go out into public and shouldn't have to go through these safer at home and shelter at home, shouldn't have to stop working. You can be on the front lines of the healthcare. You can open a restaurant and not worry about infecting customers. You could be somebody who delivers food to the elderly at home who are at highest risk for disease. So we need to have, again, massive large-scale testing for immunity and be able to tell people who's immune, who's not, so that we're able to get those people back to work sooner. So that's really, I think, the overall plan that we're going to see is we're going to see scaling up of testing, scaling up of our public health response and ability to do contact tracing and testing for immunity. We expect that this first wave in Tennessee is going to probably peak somewhere in the 3rd or 4th week of April. We'll go throughout May and hopefully die out end of May, early June. But we're going to see a second wave in the fall or in the early winter, and we have to use that intervening time between waves really to get this testing and this public health response together, so we won't have to deal with the second wave in the way that we've had to deal with this one with the safer at home and shelter in place measures. So that's all I'm going to say for prepared remarks. I'm happy to take questions for 5 or 10 minutes here before we go on to our second speaker of the day. So the first question we have up here is wanting to understand fact versus fiction about face masks. And what I'll say about that is that I think we had a disservice done us by the federal government early on by saying, hey, these masks don't help prevent infection, they're of no utility, save them for healthcare workers and don't use them. And this was obvious false information, and we put it up on the UT website. We said that's just not correct. We said what we know about masks is that they provide some modest protection for a short period of time. So if you're going and you're going to have a short-term interaction with somebody at the grocery store, you do have some protection from a mask. They're not effective if you're sitting in close contact to somebody for a prolonged period of time, but if it's just a casual encounter, they do provide some protection. So I think the government was saying that because they didn't want people running out and buying up all the masks that we were going to need for healthcare workers, but it was not good information. Now that we've recognized that there is some utility to it, they've kind of reversed course and said, hey, we do want you to wear a mask. It'll stop the spread of disease. It may provide some modest protection against the disease. And I think that should have been the message from the beginning, but unfortunately it wasn't. All right, second question we have up here is the expectation people in rural counties who contract COVID will have similar compromising health vulnerabilities like those mentioned in the African American communities? Well, we do know that we have significant chronic disease throughout our urban and our rural populations. Obesity and hypertension and diabetes in particular are significantly distributed across the state, including the rural counties. Since that is a risk factor for disease, I do expect that we're going to see similar issues with mortality and with more severe disease in our rural community as well. I do think the rural community is going to see this wave a couple of weeks after we see it in the more metropolitan regions of the city, and it may be a little bit slower just because population density is less, but it probably is going to penetrate just as much, and we're probably going to see the same sort of disease with it, including serious disease for those with chronic health issues. So the next question is the virus the cause of death in fatal cases, or is it secondary infections? So that's a great question. My personal research over the years has been on secondary infections like bacterial pneumonia when you have influenza. We do think that some of that is occurring in the most critically ill patients having a secondary infection. We have identified some secondary infections in some patients in some settings. Mostly, though, the cause of death in this is secondary to what something we call cytokine storm, which is really a massive inflammatory response of your body to the virus. This can cause your organs to shut down, your lungs and your heart and your kidneys. And most people are dying because of that cytokine storm and this kind of multi-organ shutdown that we see after it. Some people are dying purely of heart disease where the virus is infecting the heart and causing a myocarditis or heart dysfunction. And in some cases, even they're getting better from it, and then the heart fails and they're dying from the heart failure. So that's the main cause, is the organ failure or heart failure with this. All right, so the next question is, if someone has antibodies and assumed immunity, can they still carry and spread the virus? So after you fully recovered, we're not sure exactly how long the virus is shed. We do have some cases where you could detect the virus from somebody for up to a month after they were infected. We're not sure whether they were really infectious at that time. We think you're probably infectious for a couple of weeks, and then different people will become non-infectious at some rate after that. After the virus is gone and your antibody responses come up, you should no longer be able to be infected or to have virus in you and thus be able to transmit. So we're not sure the same period, but something like 3 or 4 weeks after you're infected, you ought to be immune, you ought not to be able to get the virus again, and you should not be able to transmit again. And that's the state we'd like to get everybody in, either because they've been infected or because we have a vaccine and we're able to give that to everybody. Can we talk through the possible fall shutdown again? How will it be different in the current shutdown? Well, again, the hope is that we're going to have this public health response where we're able to test everybody. And as the virus starts to come back in, we're going to be able to immediately test anybody who has symptoms. We're going to quarantine them. We're going to isolate their contacts. We're going to keep it from spreading so that it never gets so widespread like it is now that we can't manage it. If we're able to do that, we won't have to shut down our businesses and our restaurants and other things. And we'll be able to just kind of do that constant whack-a-mole, tracing the virus and kind of knocking it down every time we see it. That's the hope. That's been successful in other large countries who have done it and cities who have done it. We need to be able to do that here in Tennessee. All right, so when can we return to kind of in-person conventional operation of our businesses? There's a little bit more detail in that, but that's the essential question being asked. We're predicting, again, that we're going to see the peak of this in Tennessee sometime in late April. It'll probably occur first in Nashville, then in Memphis and the other metropolitan regions, and then a week or two later across the rest of the state. After the peak, we're going to see a 3 to 4 week wind down where the disease starts to go away. At least that's the hope. And so we're projecting that sometime at the end of May, early June, maybe a little bit later for areas of the state that get it a little bit later, that this virus will have largely come under control. And at that point, we're going to be able to open back up, open businesses. The things we're looking for to be able to do that are, first, we want hospital capacity to improve to the point where we can take care of the cases that are there without having to be in crisis mode. We want to have sufficient testing that we're not having to turn anybody away for testing, and we can test every symptomatic person in the state who needs it. We want to be assured that the virus is going away. So, we're going to want to see a downward trend for at least 14 days before we want to start opening it back up. So those are kind of the things that we're looking for to be able to go back. But it's probably about 2 months from now before the whole state's back open. Do we know the mutation rate, low, medium, high? So we do know that these coronaviruses mutate over time. This is not a virus like influenza that mutates rapidly and forms a lot of new lineages. We are tracking mutation rates. We're sequencing every virus we get here in Memphis and looking at the mutations that form as part of a large international collaboration looking at this. And of course, we're going to be worrying about whether that mutation will cause loss of immunity to those who have antibodies, or whether it's going to impact our ability to make a vaccine. The answer is we're not completely sure. We think it'll have a low mutation rate in terms of how we think about it relative to influenza or some other viruses, but we don't quite know at this particular time. All right, do we have a toolkit available for businesses for best practices for reopening? So I think the CDC has a very useful website about businesses' preparation for control of the viruses, which is things like daily cleaning, about your HR policies for illness and return to work. We don't have a good toolkit yet for the reopening piece of this. So I think that's a good thing that we need to think about over the next month. And as we start to, right now, every public health official is preparing for the surge. They're not thinking too much about what happens after the surge. I think academics like myself and others at UT are thinking about what do we do next, right? And I think as we get into and through the surge, then we're going to shift a lot of our attention to, okay, when do we reopen? What are the criteria for that? I laid out some of those for you, and I think that's when we'll start to see those sort of toolkits come out, but that's a great question. All right, is there a timeline for when testing will be widely available? Will we get a certificate stating we are immune? So it's going to vary a little bit by where you are. I think we're going to have widely available testing in the Memphis metropolitan region within the next 2 weeks. So before or around when we get to peak, we're going to have to continue to expand availability to testing after we've seen the first wave, so they're ready for the second wave. We're going to start testing for immunity probably June 1st is our goal here in Memphis. Nashville will probably have a similar trajectory, and I'm not sure about the rest of the state. My sense is that we're going to want to have some sort of documentation, whether that's a registry or a certificate or something that says that you're immune, so that when we do have future orders around businesses and closings, that those who are immune will be exceptions to that. But I think that's going to be a state level question that we're going to have to decide as we get closer to the ability to do widespread testing for immunity. All right, how should we respond when people make comments like the flu virus kills more people? Why should we be worried about this virus? Well, the answer is the flu virus has killed more people historically, but that's because we're very early in this pandemic, and COVID-19 is going to shoot right past the flu pretty soon. The mortality rate for this virus is 5 to 10 times higher than seasonal influenza, and its transmission rate is 2 to 3 times faster. So it spreads more easily, it kills more people. Over time, maybe that'll change, maybe it'll adapt to humans, and it'll be a little bit more like influenza. Of course, influenza pandemic viruses were themselves much more deadly when they came in, and those adapted over decades, or in one case over the last century, to humans and are a lot less deadly.
Dr. McCullers, let's hit maybe a couple of the most important questions left, and then we'll shift gears and look at the economy a little bit. So a couple more.
All right, 2 more. So I'll say one. What about hydroxychloroquine and azithromycin? Is this a treatment that can help us? So this has been in the news a lot, particularly because President Trump's been talking about it a lot. These are drugs that we've studied for 20 or 30 years. I personally done research on these drugs against influenza viruses, and I can tell you they look great in a test tube in the laboratory, and they don't work at all when they come out into mammals, either in animal models or in humans. They don't do anything to prevent viruses. They're designed to work against parasites and against bacteria. They have some anti-inflammatory properties in that respect, but they don't really help against viruses. Now, we are doing some testing. We're doing some testing here in Memphis and some other places because it's been talked about widely. We want to do the appropriate research to be able to say for sure about that, but my sense is that this is not going to be an effective treatment. I think the only effective treatment we'll have is the convalescent plasma for the next couple of months. All right, and there's one question here about children that I think I'll answer, being a pediatrician. And I'll say children are just as able to get the infection as anybody else. So they can be infected, and they're infected at the same rate as anybody else. They don't seem to have as much disease. We don't understand at all why kids don't get disease with this, but adults do. There's a few theories out there that I won't bore you with, but what we're seeing is that children just really don't get very sick. Now, they can get sick. We have seen deaths from kids with COVID-19. We have seen serious illness for kids, but it's fairly rare compared to adults. And really, the older you get, the worse it is, and the more comorbidities you have, the worse it gets, is really the answer to that. So the kind of sideline question to that, or what about when we're reopening schools? Are we going to expect to see transmission in schools? The answer is probably yes. But we need to have schools open. We can't keep schools closed for the next 2 years. So again, that's going to be a matter of, can we have a massive public health response and monitor the schools and take kids out of school when they get sick and put them back in when they're well again? And that may be how we live the next couple of years as we open schools up, chasing the virus in the schools. All right, well, thanks very much for your attention today. I hope this was helpful to you. And as always, University of Tennessee across the states working to, I think, help mitigate the impact of this virus and educate and inform as much as we can. I appreciate Dr. Byrd for asking me to come on here and talk to you today. I think this is a good service.
Dr. McCullers, we appreciate very much you being with us and sharing those thoughts with us, and that's helpful as we move forward in the different areas of work that folks on our call are in and making decisions moving forward. So thank you. So as we know, the coronavirus pandemic has had great impact on our economy. And we're glad to have an economist with us today, Dr. Matt Murray. He's the director of the Howard Baker Center for Public Policy and associate director of the Boyd Center for Business and Economic Research at the University of Tennessee in Knoxville. Dr. Murray, we're glad to have you with us to share thoughts on where our economy is and some projections on where things may be going based on what we know thus far.
Thank you, Dr. Byrd. I appreciate the opportunity and the invitation to be before this group. And Dr. McCullers, that was a really tremendous presentation you just gave. Very informative, very, very helpful. So thank you very much. I think everybody on this webinar is following the economy quite closely and knows where we are right now. I would argue that we are in a depression today. This is a very serious economic downturn. The order of magnitude is going to be much worse than the Great Recession. The good news is we do expect it to last for shorter duration than the Great Recession, but there is a tremendous amount of uncertainty out there. Economic forecasting is a puzzle in and of itself, but we have an underlying epidemiological problem, an influenza problem that is really driving the health consequences for society and therefore the behavioral responses of individuals, businesses, and policymakers. So the situation right now is really quite dire from an economic perspective. Looking at forecasting firms from around the country, well-regarded firms, they're generally calling for GDP to fall by 25 to 35% in the second quarter of the year. Maybe a smaller fall in the third quarter, but continued contraction. We're going to have very serious measurement problems and actually estimating GDP. We're going to have a terrible time counting all of the unemployed. We're having a terrible time counting output. And as we work at home, we're generally not as productive as we are in the office. And so measuring the productivity of the economy, and when we have mass unemployment and mass underemployment, is really very problematic. The forecasters that I tend to rely on include the Federal Reserve banks around the country, but also a firm called IHS Markit. Moody's does a good job. You can glean some information from firms like Wells Fargo and so on. You're going to be hard pressed to get hard data and economic outlook for Tennessee. The Boyd Center no longer does its forecasting update that we used to do. And so the economic report to the governor that we released actually right around the first of the year, that's obsolete, it's out of date. So you're going to really need to follow what goes on at the national level and understand that Tennessee is going to be following that wave. But it is a wave, and that's important to recognize. The entire national economy is suffering right now, but some of that is because of preventive policies and individual actions by people staying at home, businesses closing down. But the crisis is going to be a wave as it rolls across the country. We're seeing the crisis come close to a peak in places like New York, but we're going to see problems continue to mount in places like Louisiana, and then after that it will be Florida. those health problems will have implications for the longevity of this economic downturn and the nature of the response. And I'll get back to that here in a moment. GDP, we don't expect to recover to the levels of the peak of this expansion until we get into 2021. So we're going to have a period of recovery, we think, in the fourth quarter of this year and into next year. And it's going to be sometime in 2021 before we see output in the economy be restored. You may have followed the unemployment insurance claims data that were released for the national economy today, about 6.6 million new claims. That's an undercount. There are a lot of people that can't file. The online systems are bogged down. The face-to-face systems are bogged down in different ways. So the unemployment situation is going to continue to deteriorate. The St. Louis Fed is calling for a U.S. unemployment rate of 32% at its very worst. I think that's very reasonable. I'm not sure we're going to see that on a quarterly basis, certainly not on an annual basis, but I would not be surprised to see the unemployment rate here in Tennessee jump above 30%. It doesn't take a very creative scenario to get to an unemployment rate of that magnitude. If you just start whacking away at jobs in leisure and hospitality services, retail trade, manufacturing, and start picking off a couple of other sectors with job losses, you can pretty quickly get to a 30% plus unemployment rate. The labor market's not likely to recover until 2022. Virtually every sector of the economy is going to get hit. Leisure and hospitality, eating and drinking establishments, first and foremost, because they're literally closed down other than takeout, depending where you are. But every sector of the economy is being hit, including the manufacturing sector, which is very, very small. So very few sectors of our economy are going to be spared. Urban and rural Tennessee are going to both be hit and hit hard. This is certainly no silver lining, but rural economies in Tennessee already have a very small economic base. They don't have a lot to lose right now. It's metropolitan Tennessee where you're going to see the commercial base and the industrial base largely collapse, and that's going to be devastating. So rural Tennessee will not be spared, but they simply don't have the same scope and breadth of economic activity as the metros, and so you may not see the situation quite as dire there. This all has implications for government finances at the state level and at the local level. At the local level, the situation is probably pretty good for fiscal year 2020, all things considered. A lot of the property tax revenue has already come in. So these local communities, cities and counties are going to look at a real hit to the sales tax as it comes in the last couple months of the year. Other fees and so on are going to be diminished, and you're going to find liquidity problems on the part of taxpayers. And that's going to carry you into the start of fiscal year 2021 with a sales tax that is going to be very, very depressed. The property tax is going to be an issue over the year, not necessarily because of falling property values. That might happen, particularly for commercial and industrial property. That happens with a lag as it affects local government property tax collections. But there will be a liquidity problem on the part of households and businesses that will make it very, very hard for them to keep up on their property tax payments this year. So I would expect property taxes to be in arrears at the close of 2021. That coupled with a real problem with the sales tax, and then some uncertainties about shared tax revenues from the state, other kind of support from the state, as well as the federal government. So it's simply a time for local governments across the state of Tennessee to be very, very cautious as they plan and budget. Even if you've not seen this hit in a big way from a health perspective in your community, you're going to see it, you're going to see those problems emerge, as Dr. McCullers just noted, excuse me, but you're also going to see a very serious hit to the economic base. It's stay-at-home policies on the part of state government and local government, but understand a lot of businesses are taking preventive measures or would have, absent those policies, to limit access or shut down, and many individuals would have self-isolated or self-quarantined absent government policies. So the slowdown is being driven by a health problem, but the policy implications or the policy side of this is driving part of it, the slowdown in the economy, but so is individual behavior. We've had a significant stimulus package come out of the federal government, and I'll note that I just misspoke. It's really not a stimulus package. We're in a very unique situation with this recession or depression, however you want to see it. Most downturns are driven by a lack of demand in the economy. That's not necessarily the problem now, or it is in the sense that we actually can't get out and make the purchases that we want, and businesses can't engage in the same levels of activity and business-to-business trade that they otherwise would be involved in. What the federal government has done with the stimulus and what the Federal Reserve is trying to do behind the scenes a bit more quietly is inject liquidity into the economy and improve the balance sheets of businesses, large and small, and households as well. That's the real key problem right now. So when you look at these, this short-term bump to unemployment insurance of $600 per month, short-lived, but it's going to be very, very important in shoring up household finances. The $1,200 that will go to each adult in America, along with $500 per child. Some of that will be spent on necessities. It's not going to be spent, though, on things like automobiles, travel, furniture, appliances, those kinds of activities. People are going to be using it to shore up savings that will become depleted or to spend on necessities. The Federal Reserve is now got approval to buy municipal bonds, so some pretty aggressive actions behind the scenes that people aren't necessarily going to be aware of that are going to try to help asset values and so on around the economy. But I think propping up municipal bonds is a very important step. There have been lots of other things that are kind of smaller in terms of big scope, but very important for classes of American society. That includes the deferral or the suspension of payments for federal student loans to give students a bit of relief, financial relief. We're likely to see additional waves of stimulus. This is going to become ever more expensive in terms of the deficit, and we're going to run into increasing problems with an American population that wants the economy to return to normal. But that's a very problematic situation that we're in now, and it's going to be more pronounced in the months ahead. I want to talk a little bit here about the nature of the recovery, and then I'll be happy to address any questions you might have. I think it's interesting to look back at what economists were arguing for 6 weeks or 2 months ago, because they certainly weren't talking to epidemiologists or the doctor side of this problem, arguing that we would see a V-shaped recovery. I don't expect to see a V-shaped recovery. I noted earlier that the way this is moving across the economy, it's a bit of a wave. So in fact, New York is likely to be engaged in a pretty earnest recovery within about a month or 6 weeks from now. But at the same time, we're going to have other states, potentially large states, moving up towards the top of that curve. And that's going to create a real problem with the economy and the health consequences within those particular states. So I don't see this as being a sharp recovery. Another reason is that a large class of American society has lost wealth, they've lost jobs, they've lost savings, and they're going to come out of this in arrears. They're going to be behind on credit card payments, on mortgages or rent payments, car payments, and so on. And they're not going to have the financial capacity to spend. There is another large segment of American society that is reasonably healthy right now. I continue to work and draw a paycheck. My wife continues to work at Fort Sanders Hospital drawing a paycheck. Yes, our wealth has taken a hit, our pension has taken a hit, and so on, but at least our liquidity month to month is pretty good. So we're probably going to come out of this in pretty good shape, but don't lose sight of this huge share of the Tennessee economy that is not going to be in that same financial situation when this is over. This could be a W-shaped expansion. That W-shaped expansion could arrive as a result of a second wave of infections. It could arise if we decide to relax our policies too quickly and we get another wave of infections because we're not doing a sufficient amount of social distancing. A U, as I'm going through the alphabet, and there are only so many letters in that alphabet, U-shaped expansion is a distinct possibility where we go through many months of very poor economic performance before we get a bit of a lazy expansion. My bet right now is not a letter of the alphabet. I'm going to go with the hockey stick. We've seen a very sharp dive in economic activity, and I think we're going to look at just slow but steady improvement as we get into the tail end of the third quarter, and then the fourth quarter, and then the first quarter of next year. And that's going to take us to recovery in terms of levels of economic activity, by which I mean levels of retail sales, level of GDP, level of employment. Those will not return to pre-recession levels until sometime around 2021 or 2022. So that would be my best bet on the nature of this, of the recovery from the pandemic. So Dr. Bird, I will leave my comments at that for now, and I would be happy to turn to the Q&A if you would like me to.
All right. Thank you very much, Dr. Murray. We do have several questions that are open here. And are you able to see those?
I'm able to see them. So the very first question I'm looking at is whether this will accelerate the institution of universal basic income. I think we're all aware of universal basic income today, a concept we probably had not heard of just 5 years ago. Yeah, I think there's going to be increasing talk about this. The real problem is going to be the cost of universal basic income. We had a huge deficit created by corporate tax cuts. We're going to have a huge deficit created by probably a series of stimulus actions and liquidity policies coming out of the federal government. So this is likely, basic income is likely something that we will revisit in earnest after this is all behind us sometime in 2021 or 2022. And then we'll be able to clearly see the pain and the suffering on those that did not have the means to protect themselves during this, this economic downturn. The question about the stimulus package and the impact on the unemployment rate, as I've already said, I don't think you're going to see much of an impact on the economy from this first wave of transfers to American households and through unemployment rates. And the reason is that we're just dealing with a liquidity problem. People are still not going to be able to go out and spend. We can only buy so much through Amazon and online platforms. So until we're able to go back to the stores, until we're able to engage in, big ticket item purchases and so on in a more robust fashion, I don't see the situation there turning down. I don't have a good answer about how the state is going to deal with the CARES Act and the amount of money that's going to come to local governments. I think those discussions are underway right now, and I have no idea how those discussions are going to be able to play themselves out. Tracking stimulus grants for cities, I don't have a good answer for that either. I don't think we've really got the apparatus set up yet to actually track the funding, and I don't think the funding has actually gotten to the states to actually transfer to the cities. So we're going to have to just monitor this with all of our connections and with our state legislators and so on over the course of the next several weeks, the next couple of months, to see how those resources end up coming to the state in a more robust fashion. So a city that planned to put a $4 million renovation in a school, would it be wise to put that off a year? If the interest rates are going to stay low now for the next year, the next 18 months. So if you've got the wherewithal to finance using debt, this would be a good time to take that into consideration. Do note that no one is expecting interest rates. This is pre-epidemic. No one is expecting interest rates to rise substantially over the course of the next several years because we don't expect inflation to accelerate over the course of the next couple of years. But from a debt perspective, this would be a good time to incur debt if you've got the long-term capacity to pay that debt off. Out-of-state residents coming to Tennessee for the trails and so on. How do I see the interstate commerce returning with those from New Orleans, Florida, and so on lagging in recovery? I think interstate commerce is going to be very slow to recover for the reasons I've already noted. And I think that hockey stick expansion that I am expecting is what's going to hold back that interstate commerce. People are going to continue to move primarily for exercise and so on because your major venues like Disney World and Dollywood and so on are not open for business. But we are going to find large numbers of people crossing state lines, crossing county lines for recreation activities. But that's going to have a very muted effect on our economy, because your lodging establishments, people are not going to want to stay in hotels. Restaurants and so on are closed. There's not a lot else to do right now across the country other than just pure natural outdoor activities. Are there any support mechanisms for counties and small cities that rely heavily on the property tax on which to operate? I'm not aware of anything right now. Again, I think this year is probably going to close out. You're going to be okay, except for those that haven't paid yet, and now they're going to be financially challenged to do that. Next year is when I suspect there to be a problem, and then fiscal year 2022 things should improve, and then the arrears from the previous year come in. But I'm not aware of any kind of a program right now for cities and counties. This may be the sort of thing that subsequent packages from the federal government will try to address, like was the case during the Great Recession. So thoughts about how the stimulus will offset the economic downturn, just a little or a lot. I think it will have a huge effect on liquidity and balance sheets. I don't think it's going to have a material effect on GDP, on retail sales. I think it'll help some, but I don't think it will have a huge economic impact. How does the University of Tennessee confront the pandemic? Well, I'm sitting in the Baker Center here today, and we received notice today that we have no cleaning services. We're not supposed to be in the building anymore. So my recommendation for the University of Tennessee is to at least leave the Baker Center open so I have a place to go to work. But I'm guessing that that's not going to be the case. UT is want to do and follow the advice of the experts, and that is, let's practice the best social distancing that we can. So while I may be in the building, looking forward, I'm not sure what the situation will be for UT in terms of classes and so on in the fall. I would not at all be surprised if we didn't have classes offered online. But the university is trying to do that planning right now, and I would not expect a decision to be made on that till we get sometime into June or July. We'll know a lot more by then than we know today. Yes, the unemployment rate could, on a monthly basis, spike above 30%. No, I do not expect it to be 30% through 2022. I expect the unemployment rate to bottom out, or I should say peak, if you will, above 30% for a couple of months. And then I think that unemployment rate will continue to drift down. And I think by the time we get into 2021, we could be back in the single digits, but that's a gambled guess on my part. We still could be in double digits as we get into 2021. But as I noted earlier, the level of employment in the economy by 2022 should be back to where it is today. But we will have gone over 2 years with unemployment depressed from the levels that prevail today. Manufacturing supply chains. This is part of the wave story that I was telling earlier in a domestic context as the wave ripples across the American states. The same kind of wave pattern is going to take place across the entire global economy. And there will be some improvement in that supply chain depending on where the chain is. So South Korea, China, at least portions of China, maybe Germany, which is now talking about relaxing some of the restrictions. But we're going to still see spot problems with supply chains in other parts of the world that is going to represent an impediment to business. As Dr. McCullers said earlier, this could last a couple of years. And if it lasts a couple of years, we will have a full 2 years or more of economic disruptions. Should cities borrow more now to cover deficits that we will face in the sales and property tax revenue categories? I think that's a real dicey question. You know, I would first and foremost use reserves if you've got rainy day funds, but I would be hard pressed to argue, at least right now, to borrow to make up for the need to fund current government services. To the extent possible, budget and try to bring the spending down, as hard as that is. And I understand the burden that places on communities, both rural and urban, with ongoing commitments like K through 12 education and so on, that don't give you much capacity to reduce the spending side. But deficits are dicey in terms of funding shortfalls in current government revenues, because you end up paying not only for that deficit over time, but the interest costs on that debt. I think that the change in the new internet platform, it continues to evolve, but we're capturing more and more sales. I think it will benefit county sales tax revenue under the current circumstances. I had a call a couple of weeks ago where this came up, and there generally seems to be a consensus that the state is pretty good in accounting for where these sales are currently taking place. And as such, they should be able to get the sales tax, the local option sales tax revenues allocated to the proper situs much better than they could have done a couple of years ago. So we know internet sales are going up, and that will be of great benefit to local communities. But we also know that things like automobile sales and furniture and appliance sales that are a significant share of sales tax revenue are going to suffer. And I want to emphasize something that I emphasize whenever I talk about sales tax revenues, and that is that about 1/3 of all sales tax revenue in Tennessee comes from business-to-business transactions. So a realtor that buys a desk or buys a computer pays sales tax. Manufacturing firms pay sales tax on all of their office equipment, file cabinets, carpentry, all of that. So when you've got a slowing economy and business-to-business transactions suffer, so do business-to-business sales tax revenues. So those are going to be hit. But to the point, yes, it's going to be, the internet sales are going to be of some benefit as they go up to local communities across the state. Changes to the healthcare system in Tennessee as a result of COVID-19. I'm not really an expert on that. I think the real problems we're going to see, the metro areas, we'll see how they weather the storm of the peak of the curve. I'm really worried about rural Tennessee, where you have a lack of opportunities for hospitals and lack of hospitals, period. It'll be interesting to see how they are able to deal with this problem if, in fact, they face the same kind of problem that the metros face. Dr. Bird, did you want to chime in on that?
I don't have anything to add to that. I think you
Okay.
hit it, and one of the things that we're dealing with is rural healthcare in general, and I think there will be some impact there based on what you said.
So many economists feel we were heading toward a recession nationally. I don't think we were heading towards a recession. The forecast that I released around the first of the year under the auspices of the economic report to the governor called for a slowdown. But in that, I also noted that it would take a shock to the economy to push us into recession. And we've got the shock that's doing that. We are certainly in recession right now. We will certainly see 2 consecutive quarters of decline in GDP, and that is the definition of a recession. So I would argue we are in the midst of a recession right now. The depth of this, we may end up calling this the second Great Depression when it's all said and done. How will this affect BE funding to counties? I do not know, and I think it's probably too early to tell. The state has its financial commitments. The good news that the state is that the state has a very substantial rainy day fund. Whether or not it chooses to tap that rainy day fund in earnest remains to be seen, but we do have that rainy day fund available. It remains to be seen whether the federal government comes along with additional funding. During the Great Recession, we had funding from the federal government that included maintenance of effort requirements. And so we were able to, we did a pretty good job in Tennessee of maintaining funding for K through 12 education and for higher education through the federal funds that came to the state. We may see that kind of support come in future waves of support from the federal government. And another question about issuing debt. I think this is a good time to issue debt if your long-term finances are in good shape. This is, if you can sell them, sell that debt, that's a problem. But if you can find the financing today, I would think it would be a good time for cities and counties generally to issue that debt.
All right, Dr. Murray, I think there's one more. Do you see consumer product prices to increase to combat businesses' lack of profitability or to lower because of supply and demand laws?
Yes, I think both. We're already seeing businesses in some instances raise prices. Too early to tell. We know some prices have gone up. We know consumers have observed that, and that will help businesses. But there also will be this substantially diminished pace of sales that is likely to significantly overwhelm any increase in prices. Businesses are not going to be in a position to raise prices substantially today for fears of creating a perception of price gouging. And so expect price increases to take place, but I would expect them to be very, very moderate because businesses don't want the bad PR being accused of price gouging.
Dr. Murray, we thank you for being with us today and appreciate very much the information that you shared with us. For all of those who have joined us on this webinar, we hope that you've gotten some information that you can use as we move forward in some very uncertain times and as we plan for things that we need to provide for our customers and those that we serve. Again, we appreciate you being with us very much. This webinar has been recorded, and we'll post a link to it and send to those of you that were on, and you can share it with others, and I'm sure our agencies will have a link to it from our websites. So thank you again for being with us today. We'll continue to do everything we can to help you as we move through these uncertain times. And at this time, we're especially grateful for the relationship that the Institute for Public Services and its agencies have with other parts of the university that made this webinar possible. So thank you for the partnership, Dr. Murray, and for Dr. McCullers and the Health Science Center. We're grateful. I hope everyone has a wonderful rest of the week. Goodbye.
Thank you.